Good afternoon, Commissioners. I appreciate you having me here. Before I get started, I want to thank the team at Forsyth County Department of Public Health and our communicable disease team that are working hard right now behind the scenes. So first of all, Forsyth County Department of Public Health officials are identifying close contacts to these two individuals to monitor symptoms and contain any potential spread. To protect the individual's privacy, no further information about them will be released. These cases are related to travel outside of the United States and not attributed to any community spread. The Forsyth County Department of Public Health is continuing to collaborate with the North Carolina Department of Health and Human Services, other local health departments, and healthcare providers, as well as community partners, which include Winston-Salem Forsyth County Emergency Management Office, Novant Health, Wake Forest Baptist Medical Center, and our local public safety partners. Health officials suggest residents should take the following standard precautions to help protect themselves and others from this respiratory illness. Wash your hands frequently with soap and water for at least 20 seconds each time. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people that are ill. Cover your mouth and nose with a tissue or sneeze or cough into your arm. Do not reuse tissues after coughing, sneezing, or blowing your nose. Clean and disinfect surfaces that are frequently touched. And I see that Commissioner McDaniel has her Lysol here, so she's ahead of the game. Asking people to stay home if you're sick. Have a plan in case you need to miss work or other responsibilities due to a personal illness or care for a sick family member. And for those that are over 65, they're the most vulnerable, or those that have chronic health conditions such as heart disease, lung disease, diabetes, or other conditions that may weaken your immune system. So we're asking those individuals are advised to try to avoid large gatherings, such as church groups, concerts, community events where there's large gatherings of people. And again, I would add that these items that we've already stated about disinfecting surfaces, washing your hands, staying home with your sick, these are things that we tell people with a cold and flu, or really any time of the year. These are good health habits. So testing for COVID-19 does not occur at the public health lab. We collect and submit specimens to the state public health lab. The state public health lab performs presumptive tests. Additionally, private healthcare providers can collect and submit specimens through LabCorp, which is working in conjunction with the state lab. The guidance from the state for testing is for persons with cough, fever, shortness of breath, and exposure to someone who has tested positive for COVID-19, or cough, fever, shortness of breath, negative flu test, and possible exposure to someone with COVID-19. So again, just to state, both of those scenarios, it's all of those: the cough, the fever, the shortness of breath, and exposure to someone who has tested positive for COVID-19, or cough and fever and shortness of breath and negative flu test and possible exposure to someone with COVID-19. If you meet all of these criteria, call your healthcare provider. Call your healthcare provider for further guidance. At this point in time, we're only collecting samples. The Forsyth County Department of Public Health is only collecting samples for those Forsyth County Public Health is actively monitoring. Those are individuals that the state has advised us to monitor. All others, if you feel that you may meet those criteria that have already been listed, please call your local healthcare provider. As with all illnesses, as I've already stated, stay home when you're sick, wash your hands, avoid touching your face with your hands. And I'd encourage the public to get their information from reliable sources. There's a lot of misinformation out there, so we're encouraging everyone to get their information from reliable sources. Those two are the CDC and the Department of Health and Human Services. That's my statement. I'll be happy to take any questions.
Questions for Mr. Swift? Comments? I have one question. Everybody's saying this is what you ought to do, and I have all kinds of people making comments. But I heard one person say, well, if you have the symptoms, the cough and the fever and that type of thing, don't go to the emergency room because you'll just infect everybody else. What do you say to that?
Well, I would tell individuals, one, to make sure that they know their symptoms. They have to have all those symptoms. And I would encourage individuals, you can go to the CDC and the Department of Health and Human Services. If you go to the Department of Health and Human Services, the state has set up a toll-free number for people to call. I mean, to call with questions, where you can ask a trained public health nurse at the state these questions. And if after that you feel that you need to go to your doctor, the best thing to do is call your healthcare provider. Because a lot of this is, one, people are getting the misinformation, and people may have the flu, or people may have a sinus infection or something like that. So please call your healthcare provider if you do, in fact, have those symptoms.
Well, this thing has really gotten big because the NHL has canceled all their games. The NBA has canceled all their games. And as we do this meeting, the ACC tournament is going to continue, but ain't going to be nobody in the audience.
True.
So having said all of that, and everybody's trying to get used to it because it's coming quickly, like almost like a tsunami to my way of thinking. How do you begin to reconcile the difference between acting and reacting out of concern? There's a difference. Reacting is a whole different world.
Yeah. I would rephrase that, Chairman, to there's a difference between reacting and responding. Our goal right now is to respond and to be proactive. And I believe that we should be most proactive to protect those that are most vulnerable, which is those individuals that are over 65 years of age and those with conditions that could compromise their immune system. And so with any time you have something like this, it's best to take proactive steps, and you can see some of those steps that have been taken at the national and international level. So,
and it is curable, right? The virus is curable.
Well, at this time, there is no vaccine, but there is a very high recovery rate. The vast majority of individuals that are diagnosed and confirmed to have COVID-19 have minimal symptoms, very few symptoms, and just a small percentage need medical care.
What would you advise folks with infants, babies, and older people who are considered senior citizens?
Well, I am not a doctor, and this is very new and this is very rapidly evolving. What we are seeing is that the young have less complications at this time, but obviously we should take steps to protect our very, very young, such as our infants and children. And again, I would say even with children that are old enough to walk and talk, teaching them how to wash their hands and keep their hands out of their mouth, and if they're sick, to stay at home. As far as our older adults, again, the guidance we're getting is for older adults and those with immune compromised conditions such as heart disease, lung disease, diabetes, and other conditions to be more cautious and look at probably taking steps as far as avoiding large gatherings or large crowds.
Commissioners, anyone have a question or a comment?
One question, Mr. Chairman.
Yes, sir.
Joshua, I've gotten several calls about the whole test kit concern. Mm-hmm. As our health director, do you feel confident that we have enough test kits for Forsyth County?
Well, as I said, there's some miscommunication out there. What is being done at the local level is collection. Then the test kits are at the labs. And now those collections are being sent, those specimens are being sent to the state public health lab as well as LabCorp. But again, we're advising individuals, if they have those symptoms that have been mentioned, they need to call their healthcare provider and see then their healthcare provider can take those that specimen and send it to the state or to LabCorp for testing.
Well, I want to thank you for your acute updates to all of us on this matter, because it is a concern, but you've handled it very professionally, so thank you very much.
Well, thank you, and I just refer that to a great team that's very professional. And, public health, we've had plans in place for things like this. It goes back to 2009, H1N1. A lot of people don't remember that, but we've dealt with things like that before, but a great team. So thanks.